Hi, viewers. You're welcome to another episode of the Break It Down Climate Conversation series. This is a special episode or edition of the Break It Down podcast focused on climate and health conversations, drawing of insights from the Future of Health conference and various ongoing conversations on climate and health in Nigeria and across the African continent and globally. I'm Emeka Ogwano, Senior Partnership Manager at Nigeria Health Watch. This is the fourth episode in this series, and we have a very special guest. Happy to introduce to you Nanlop Ogbureke, the Executive Director of Resolve to Save Lives Nigeria. Nanlop, you're very much welcome. Very excited to have you share insights from Resolve to Save Lives experience and work in Nigeria. Resolve to Save Life, of course, has a global view, global perspective, and your work and reach cuts across the globe, really. Many countries where you have presence in. You've done a lot in epidemic preparedness, pandemic preparedness, and response during the COVID. So much insights to share. We're also very happy to have you at the Future of Health conference. We also want to continue that conversation here. To share insights. You have very over 20 years of experience in the health sector, really, and a lot of which has been in senior leadership roles. So we're very excited to have you here, also to build on ongoing conversations on the climate and health conversation. So glad to have you here.
Thank you, Emeka. It's also exciting to be here to continue the conversation that was started. I think that was in October.
Yes, October 24th.
Yes,
Yeah.
before the COP 29 that happened in November. So I'm excited to have this discussion, and let's continue the conversation on the nexus between climate change and health. Yeah.
Fantastic. So, we tend to start the conversations here in a very different way. Other than asking you about maybe yourself or your work, we would like to, start up with laying the foundation on Resolve to Save Lives mission, basically. On your website, it stands out very boldly. Responsive health systems is the bedrock for epidemic preparedness, really. And it's interesting because if you see my cap is given to, yesterday was universal health coverage, and I'm just coming from an event on universal health coverage. The conversation is very key and it's very, of course, relevant to the context of our conversation here, building resilient health systems. And perhaps to ask, from the Resolve to Save Lives perspective now, what does building resilient health systems mean to you, and how does your work, how is your work relevant to that?
I think when we talk about resilient health systems, there's resolve to save lives and the contributions that we make within the space when we talk about resilience and climate change. However, resilience is something that has been discussed over the years, mostly within disaster risk, reduction settings. When talk about humanitarian response and conflict, there's so much that happens when they talk about strengthening communities' resilience to adapt or to respond to shocks and issues that happen within their own communities. And so health came in. I think my first engagement or interaction with bringing together what we describe as a climate change and health nexus, as we caption it these days, was I think in 2017. So I had 2 weeks in South Sudan where in my before Resolve, that's some years ago, of course, and this was coming against the backdrop of looking at resilience within different sectors. Traditionally, that organization had worked within, like I said, talking about disaster and risk reduction. And the tools and methodologies that were used mostly in conflict settings or fragile settings. But at the time, I was the global health program, lead, And we were looking at South Sudan because of the conflict. However, there were other health issues that were coming out in that setting. And so we decided to test the resilience framework that was developed by that organization in consultation with other sector program leads to apply or to use the tools that we're using. So what we did was to use what we call the participatory vulnerability assessment that was done. So multiple tools make up that whole package. And we decided to test it for health. So that's been my experience. It was quite an eye opener because we also had to look at stakeholder mapping, working with communities to determine what the risks were in their own communities and developing areas, developing what you call a community action plan. So the community action plan identified the roles and responsibilities of community members, how the impact of climate change, like droughts were happening, flooding was happening, and the diseases that came from there, and who were the most impacted: women, children, malarial diseases that typically happen around certain seasons. And we use seasonal calendars. A lot of those tools were part of what was used at the time. And so linking that to Resolve to Save Lives now, we have a project that we're currently implementing, which is more around, so it uses seasonal calendars as well. The Enhanced Situational Awareness Project, ESA, popularly we call it, describe it as popularly described as, ESA. And we're supporting the Nigeria Center for Disease Control, NCDC, to implement this. But to be able to do that, we're using seasonal calendars, to kind of track what diseases occur at what seasons. And that is very closely linked to climate change. And we've seen that
Absolutely.
sometimes the data changes over time. We could say, oh, there are peak seasons, like we know for cholera or Lassa fever and things like that. We're using that through that project and following the data and seeing when it rises. I think it's worth mentioning that to be able to get the data to make sure that the accuracy of the data is important. And to do that, there's NIMET. It's interesting to know that NCDC and NIMET just signed an MOU to partner, so they're able to access data because NIMET has a lot of data,
Absolutely.
readily available to kind of shape how we respond, to health epidemics as they emerge.
Great. I think this is very interesting that you've touched upon not just Resolve's work in the using the seasonal calendar to sort of like feed into response systems or interventions, but also even mentioning the MOU with NIMET, because I've always known that NIMET has been part of some of the technical working groups at the NCDC, like that of the cholera and all of that. And it's a conversation that I'm happy to dive into, during the course of this conversation, as, in terms of how we use some of these data that you've just mentioned now that are very available with NIMET, changing temperature data. We know that NIMET collects this data, right? But how are they being utilized? Not just at the national level, but also at the states level. Do the various stakeholders that need to make use of this data, do they have the capacity to make use of this data? Perhaps it's something you might want to touch on. What has been your experience in seeing the utilization of this data that is available?
Yeah. When we talk about utilization, I think, excuse me, for utilization, we have to have the data, right? We also have to interpret the data.
Yeah,
What's the data telling us? And who exactly would need to use the data to make informed decisions?
exactly.
But there's also how you generate the data. So there are different ways. When we talk about specific to NIMET, of course, they've been doing this. They have all that data reposited. But organizations or institutions such as the Nigeria Center for Disease Control have what we call they have a software that helps to populate information from different states, from communities, and it feeds into that whole database across different diseases, depending on when the season
Yeah.
comes.
Is that the summers?
So there's SOMAS, but there's sit-aware as well.
Okay.
I'm talking
Yeah.
specifically now for sit-aware. In terms of its use, there's SOMAS also used to triangulate the information that comes from sit-aware, right? There's aggregated data, but then if you want to really drill down, you can go to SOMAS and try to sit-aware rather, and try to pick out which diseases and what peak period and all of that. Having said that, the decision making comes at different stages. And I would like to say that at community level, if we're able to work with communities to generate the data, they can actually generate certain quality of data. So it's following that data. Apart from, of course, the regular ones through the health facilities, for instance, or using the field epidemiologists to kind of get information and feed it through those systems that we have. Having said that, I think what's important is to recognize that the agency, NCDC, can make decisions even in preparedness when we're preparing. There's the preparedness and there's the response. So the epidemic preparedness and response team can design or structure their plans using that data, knowing when to prepare ahead. If we know when cholera is going to happen, what do we do? Do we prepare ahead? What do we need PPEs? Is there the whole conversation around vaccines? Do we also need to be able to increase IPC, hand washing and all of that? So that is also how we use the data to inform our plans, preparedness and response plans. That is probably the responsibility, perhaps you would say, at agency level and with other partners, government officials.
Yeah.
But there's also the decision making, informing even individual or personal responsibility to adequately be prepared and prevent actually these diseases or outbreaks by individuals, even in communities, even in terms of spread. Yeah.
Right, and I'm sure there's also that part of informing policy, shaping policy, utilizing this data, and so there's the policy angle, but also as it relates to climate change, maybe something I would also want to know is how much of climate considerations are being factored into this data that's been generated, especially using existing frameworks like the CETA where you mentioned or the SOMAS, right? To ensure that as we are collecting health or disease surveillance data, they also have climate considerations there to ensure for a more holistic response. And also it begs the question, what is the future of early warning systems as well?
Okay, so that's a very loaded question.
You can take them one at a time, really.
I think that whatever the decision for disease surveillance helps you to get that's data actually. You're actually, but to be able to actually do the disease, to actually survey or do the surveillance of diseases, we also need to know when's the peak period. So that's where climate change comes.
Yeah.
So it's kind of like, okay, we use seasonal calendars. We kind of track when is malaria most likely during the raining season, when is cholera bound to happen during, certain seasons, Lassa fever and all those diseases. So that is one. Over a period of time, we kind of there's a trend analysis that can be done that kind of helps with the forecasting. So we're able to forecast and know when certain diseases are likely to happen and then increase the capacity for disease surveillance of those diseases. We plan for that. And it's well planned also, like I said earlier, about preparing to respond in the event of these outbreaks during those periods. That's on the one hand. On the second hand, because of climate change, we know that those trends and patterns or projections, when you're doing the forecasting, sometimes we're noticing that there's a shift. So if over time, traditionally, we say maybe Lassa fever happens, I mean, this is hypothetical, just to say, okay, maybe malaria, let me use malaria as an example. Perhaps we say, okay, we usually during raining season has probably changed. If it typically
Yeah.
happens it starts in, April, May and lasts and ends probably in October or maybe even mid-October, thereabouts. Now we're having rains all the way to November, or it's even late. So does that really, I'm using that as a very narrow description just to explain the point. When we say malaria happens, or the peak of malaria season is in the peak of the rains. But when is the peak of the rains? If it's now changing, or even in terms of the quantity of rain, or when you have experienced flash floods. So does that really help us to project? But I'll circle back to NIMET as a point. When we go to NIMET's data, they are able to pick up these trends in real time. So it's and even forecast what what how the rains are going to be. So it's basically being able to pick up on those data points and aggregating all of this together, triangulating the information we have and making decisions on the basis of that, or at least shaping policy.
Yeah. What immediately comes to mind is how effective the aviation system has been able to use climate data to inform their decisions. I would say in real time or almost in real time, given that sometimes if we all know that bad weather, when the weather is so bad, and I believe they receive this data from perhaps NIMET or whichever agency is monitoring and feeding into them real time, they're able to tell you when they can fly or when not to fly. Sometimes flights are cancelled, abruptly due to bad weather, and we can't do anything about it. And they tell you that it's as a result of bad weather. And it seems, we're not sure if our health system is that responsive really in terms of this agility and speed at which we are using those climate data to, make those informed decisions, like you say. And perhaps, of course, is also good and interesting to know that and the in-country at the NCDC level, at least, that effort is there, and all that effort is being strengthened due to the given the MOU you mentioned as well. But also there's we're not so sure of how much is happening in that regard, or perhaps we need to tell our stories more. I was interesting, or kudos to also say that came across the story of how Resolve to Save Lives supported Uganda, of course, with other partners for early detection of anthrax, in Uganda through early warning systems, from mechanisms that we're talking about like this. And these are things that perhaps we'd like to see more of in Nigeria as well, or perhaps at least being communicated more so that they can inform lessons for more, interventions that can be built upon. But also something that you touched upon a bit earlier, which you also sort of emphasized at the Future of Health conference, which is that climate change is an issue of social justice. And it's something the minister also emphasized at that conference as well. Is this something you also want to better contextualize here, given that we had somehow, COVID is still relevant, right? And we know the experience from COVID, how, COVID taught us the need for a whole of society approach, in responding to health emergencies. The fact that it's not just the health issue, but, other social determinants as well. Maybe you could perhaps help unpack that, and, what you would like to see more of, the kind of approaches you would like to see more of that addresses climate change as a social justice issue.
It's interesting that you picked up on that. We had a very limited time.
Yes.
So everything was pretty much, we had to, pretty much squeeze everything in a few minutes. But I mean, I think when we talk about social justice, it's actually twofold for me, on the personal level and on the societal level. On the personal level, I believe that whatever it is that we do, it has to be for the greater good of the people. So there's always something that each one of us can contribute to bring that for change to happen. They're little, just small, just little drop by drop, we can actually change things and move things, Um, and by that, I mean that, simple tasks, for instance, of how do we manage plastics? Do we recycle plastics in this conversation? Or who are we even informing? The knowledge that I have, what practices do I, hand washing, for instance, do I have access to clean water? Do people have access to clean water, even around me, in my community, my own village? And it's very easy for us to talk about health mostly through a clinical lens. And that is typically how um, I get to see our approach to health development generally. But it's not all doom and gloom, because I also see that there's a discussion about social justice and social change. Um, having said that, at a societal level, when we talk about health, health is a human right. We're talking about universal health coverage. The three major objectives that are interconnected with UHC. You're thinking about, equity and inclusion. We're talking about financial protection. And we're talking about, in terms of managing, equality and making sure that everybody has good quality services.
Definitely.
Those are the major that's pretty much the underlying principles of universal health coverage. So even when we talk about all of sector, it's still talking about that, making sure that we use a multi-sectoral approach to addressing health issues. And climate change and health is no different. And therefore, when I said about social justice, it's actually putting on the, coming in with that mindset, a clear view, and looking at our health interventions through that lens. So, what does social justice mean? There was the COP29 that just finished. So COP29 just finished. What was it? It was heavily on climate finance, but it's focusing a lot on. I don't think in the whole narrative, I followed it. I wasn't privileged to be there, but I followed the conversation. And most of the report that is coming out of there is so much focused on fossil fuel, talking about the ecological impact of climate change. But I didn't see strongly the implications of what is happening in the environment and how it touches on health. The second part of that, talking not only of COP29, but in this climate change conversation or the climate and health narrative, is just recognizing also that environmental issues, the One Health, when we talk about preventing epidemics, the One Health model talks about animal, human, and environmental health. But then we it's still siloed. So I guess when I'm talking about social work, we should look within, it is presented in different forms. But when you talk about universal health coverage, it means the whole of society looking at multi-sector, implications or contributions and partnerships. If you go to health security issues, when we talk about epidemic preparedness and prevention and all of that, it's still the same. Where do people have the voice and the agency to be able to amplify some of the issues as it affects them?
Yeah.
Are communities empowered to be able to adapt to the effects of climate change, even on their health? So when we talk about social justice and bringing about change, I think it's multifaceted, to address the issues.
Yeah, I mean, I like how you hit the nail on the head on how all encompassing that is. And we also know that multi-sectoral partnerships and collaborations is at the core of what you do, is at the heart of Resolve to Save Lives mission, collaboration and partnerships with government and, of course, in-country partners. And all of that's something you're doing very well. What has been key lessons learned from your work in country and beyond about scaling these partnerships and collaborations, but in this case now to build resilient health systems?
I think when we started this conversation, you started with a quote, right?
Yes.
Yeah. Maybe you can repeat that quote again, and it will just help us see what it is
Yeah.
that for resolve. Um,
Yeah, it says responsive
response.
health systems is the bedrock for epidemic
Epidemic prepare.
prevention or
So I think
preparedness.
that kind of it encapsulates basically what we do.
Yeah.
But then bearing in mind that resolve to save lives, that's RTSL now, we look at both. There's the PE side of our work, which is prevent epidemics. That's how we describe our health security work. But then we also have cardiovascular health.
Yeah.
So it looks at non-communicable diseases, particularly hypertension. We look at nutrition policy work, looking at sodium reduction and trans fatty acids. These are contributors, right, to
Yes.
cardiovascular health issues. And that's the approach that we use. And they're both very relevant. Sometimes I say to my colleagues and others that, we're talking about infectious diseases on our PE work, and we're talking about non-communicable diseases on the other hand. So it's a holistic package of work that we do. And in the midst of all of this, climate change is still important. I know a lot of what we've said now, it's looking more on infectious diseases, but then there's also implications overall with health, which also includes NCDs. So for RTSL in country, there's a lot that we're doing. We're supporting governments. Most of the work we do is providing technical advisory support. We have partners that we work with. We also support globally, WHO. We're quite, maybe you would have to edit this out, but WHO, we're kind of behind the scenes. So we're embedded. We use an embedded approach. So you'll find Resolve to Save Lives embedded within teams, providing additional capacities to support the work that they do. So in that sense, we shape policies, we support with shaping policies using evidence. The climate conversation, the sit-aware, this epidemic ready piece, I think I should actually touch on that. On like for epidemic ready PHC, the reason I mention it is because it closely links in with our partnership with organizations such as AFINET, the National Primary Healthcare Development Agency, and all of that. So I don't know. I think that's kind of I'm trying to respond to your question, but there's so much that is packed in there, and there's a value in not going alone, but working with and strengthening systems to achieve.
Okay. Perhaps to rephrase or to ask the question a bit differently, it might be on challenges. What are some of the challenges in driving partnerships and collaborations, whether at the global, national, state, or community level, that has impacted your work, and some of the innovative ways or sustainable ways you have found to get around them, if there's any that comes to mind?
I mean, challenges. I think it's not only for RTSL really. I think generally there are challenges working within the space that we are. We've touched on. I think one of them would be that comes readily to mind would be leadership, and also the governance systems, thinking about coordination and strengthening collaboration across multiple agencies. I think a good example would be if I use epidemic ready PHC as a case study. So that is PHC. In Nigeria, I mean, it's not news. For as many conversations have been or rooms have been in, two words, collaboration and coordination, always comes to the fore. And that in itself is a challenge because we have many fragments. The fragmentation within the health sector is very palpable. And I think on this with SWAP and, with the health sector renewal initiative of the current health sector leadership, maybe that would help. That whole of society, whole of community, whole of, there's pretty much health for all approach. Maybe it will help. If it's implemented, And there's also the support, the political support. I don't want to say will because, of course, we can always want to do something, but the political action, is also very important. So that has been the challenge. I mentioned ERPHC because we have the National Primary Healthcare Development Agency. Because PHCs, of course, are kind of governed under that system. Now we have another layer of Algon. So we have the local government who have autonomy. So how that dynamic is going to work is something that I think we're still going to have to work through. It could be a challenge and it also could be an opportunity. And so for epidemic-ready PHCs, how do we build the capacity of primary healthcare centers to be adequately equipped and prepared to actually identify, when there's a disease outbreak, or even to protect the healthcare workers to be adequately enabled, to respond or at least to report. So that disconnect is often a challenge in the course of our work, navigating the leadership and the different layers of institutions. I just need to throw in the National Health Insurance Agency.
Yes.
Because that's the sub-national level. We've also got the state's health insurance. I don't know there's the Basic Healthcare Provision Fund, which has a certain percentage for health security.
Yeah.
And that has been, how flexible is that funding to be able to rapidly respond when there's an outbreak for surge support, for instance. So those are some of the areas where I know that we've actually, for RTSL, in working within the space that we work, have been like sticky points for us to navigate. Who do you hold responsible? Which organization or agency is accountable? And just navigating all of that sometimes can be quite challenging.
Absolutely. It's a very complex landscape, really. Yeah. And so many moving parts and so many, individuals that commitment, strong leadership are expected from. And as we wound down, really importantly, but sadly, would like to, this is more like our closing segment, really, where we take up to 3 questions that's short bursts. So we expect short burst answers like in 60 seconds. And the first will be, of course, RTSI is a global organization. So, and even though you lead the work here in Nigeria, you have that global perspective to the work. So this question is one I'm hoping to get your global perspective on, which is, if you could enact one universal law that that would have the most difference or that would make the most impact in addressing the climate crisis, what would that be that everyone would have to follow? So let me take it again. If you could enact one universal law that everyone would have to follow that would have the most impact in addressing the climate crisis, what would that be?
I was going to use a slogan. The popular one where they say, don't make decisions for me without me.
Yes, absolutely.
So that is basically, let's have at least policies that are reflective. We have a law that any policy that is going to be crafted or anything that is going to be framed for the benefit of the community has to also reflect their voices. Community voices are very critical. It should be mandatory that community voices and community realities should be reflected in whatever decisions are going to be made for climate change.
Apt. In fact, on a scale of 1 to 10, how much do you think community voices or perspectives are incorporated in policies being driven at the moment, whether it's for climate change or just health focus only? On a scale of 1 to 10.
With 10 being the highest?
Yes.
I would say 3.
Wow, that's very low.
It's low.
Wow, we have a lot of work
There's a lot of work to be done because most of the time it's top down. Yeah. I mean, even in COP29, how many community representation did you find? It's mostly senior leaderships and politicians who are making these decisions. If, in fact, not about only just the local communities, but I'm also, let's even look at the divide. It's about equity as well.
Right.
So it's not only, when I say community, it's not only about community voices, rural communities. That is one across the strata. But there's also low and middle income countries that are not adequately represented, or developing countries who is almost like being told what to do in terms of the response for climate change, as opposed to having that space and representation to actually speak and own and influence, the decisions when it comes to what affects us.
So,
Yeah.
you're saying that it's not just enough to have some of these organizations that work at the community level that understand the community experiences and insights. Take for instance, very quickly, is for Nigeria Health Watch, for instance, we have this project, very key project that's important to us, which is on the Community Health Watch project, where we work with leadership at the community level and individuals and health workers to sort of like monitor healthcare delivery at primary health facilities.
Yeah.
And we utilize these insights for evidence-based advocacy with community members, connecting them to the leadership, right? So people like organizations like us that work at that level, it's not enough for us to be at the table advocating for representation of the community members. They themselves have to be given a seat at the table. Is that what you're saying?
Yeah, that's part of what I'm saying.
Perfect.
Because you can go there and say, "Oh, I mean, I've worked also at community level. If we're not careful, we could live with a tokenistic view of how the community voices should be represented, or we could actually have those community leaders, not necessarily positional leaders, but people who have been able to make a change or who have lived experiences to speak to certain issues by themselves. So that's part of the community. But then it's also the same it depends, community, if you're looking at it from a global remit. If you're talking globally, you would say, okay, you have the G7s or the G8s or the G20s, but then you have developing countries. Do they actually have proper representation in the spaces to make those, to influence certain decisions that affect countries such as, Nigeria, or those who are within a certain poverty bracket,
right?
Or vulnerability bracket, as the case may be.
Right. So, moving on, it's usually very important to learn lessons when things don't go well, but it's also equally important to learn when things go well, which actually fuels a project we have at Nigeria Health Watch called where we implement the Solutions Journalism Initiative, where we focus on solutions that are actually working to also spotlight them and learn from them. So in this case now, is there a climate health intervention, it could be adaptation or mitigation measure, that you feel isn't giving sufficient attention, but you believe should be given sufficient attention or should be scaled up?
I'm not sure I understand.
Okay, so I'll take that again. So, it's very common to learn when things don't go well.
Yeah.
Right? From experiences, from field interventions, or where there's significant challenge. But it's also important to learn lessons where things do go well, which sometimes isn't given enough attention. And this fuels a project we have at Nigeria Health Watch, which is the Solutions Journalism Initiative, where we try to focus on solutions that are working, or innovations that are addressing various health interventions, spotlight them, learn from them, and also document these in storytelling ways with the media. Is there an intervention, it could be a climate adaptation or mitigation measure, that you feel isn't given sufficient attention, that could be scaled up and would have significant potential to addressing the climate crisis?
I think, there's a lot of It's called different. It depends anyway. But what comes readily to mind will be a methodology that is quite universal, that I think should be integrated within health development programs like what you've described, which is like I said, participatory vulnerability capability assessment, PVCA. People call it different things. But the reason why it is called participatory vulnerability is because there are different tools where it's participatory because you work with communities or groups of people who are mostly impacted by the issue, if it's a climate change issue. The vulnerability is also, we use a vulnerability matrix to know who are affected and to what degree. The capabilities, whether the communities have the capacity, what tools or what is within their environment, what is within in terms of resources that they could use as they try to adapt to issues around climate change and how it impacts on their health, for instance. So this is all the different data elements that come from this exercise or the use of this methodology helps with the designing of whatever interventions we want to do, because it recognizes it recognizes and takes into account the reality on ground, which is evidence-based. So I think that is one tool which has been adapted. Tools like that is what has been adapted on the ESA project that we have. We're currently implementing, which in some ways touches with what you talked about, you read in Uganda, the Uganda experience.
Right.
When earlier stages of the ESA in Nigeria, there are a number of states that we're working with, and they feed into the data they obtain, also feeds into that sit-aware mechanism, FCT, and a couple of other states, and it's expanding. So I think maybe that's the second point I can say of, what is working, and what if it is expanded, there's a lot to be learned and it can be amplified. Yeah.
Right. Interesting. So the last but not the least question, which is one that we hope we would like you to leave us to recommend a guest. I mean, as you can see, there's a lot to unpack within this conversation of building resilient health system and the various key stakeholders within the space. So who is somebody that you would want to recommend for us to have as a guest to take the conversation further? And what question would you want to leave for such a person?
I don't know. I can't mention a name, but I will give you that assignment to just kind of scope. There's what was the report that was just
the vulnerability
assessment that was done.
Is that different from the kind of nature of approach you just talked about now?
So it's similar. That's why I said it depends on, and then the scope also determines to what extent, because what was done was countrywide.
Right.
So you're kind of picking up hotspots of whatever areas they might. Yeah. So it's very similar. And I think they also used sub tools like the seasonal calendar and things.
Excellent. Yeah.
So I think the next guest we should have will be somebody within that team or whoever it is that kind of championed that. You could choose whoever anyway, but that tool will be something to the findings from that will be worth discussing, and maybe give it a twist. What is the health implication? So we have this fantastic assessment report.
Right.
How is it going to be implemented? So we'll look for somebody within that, somebody who can speak maybe from the World Bank or WHO or someone who can actually speak to that document in its translation of the implications for shaping our framing the health direction that we're looking at.
Yeah.
It was mentioned at JAR as well. So I'm kind of like, maybe there's something in there. So maybe get somebody from
Yeah,
to talk
absolutely.
about them.
Thank you. I have some people come to mind already, and thank
So,
you for pointing us in
yeah,
that direction. And
yeah,
it's been a fantastic conversation having
hmm,
you. Can't thank you enough. Really, you've seen a
thank you.
lot within the course of your work in the over 20 years that you've been in the health sector, and I'm glad that you've you've graced us with your presence to really
Mm.
share some of the insights of your work, and you've certainly said a lot. And we hope, hopefully,
Mm.
could see you some other time on this show. Who knows?
Yeah,
Yeah.
thank you.
Thank you so
Thank you
much.
for having me. Maybe if not on this show, in other forums as well.
Absolutely, absolutely.
On a slightly separate note, but relevant, would Nigeria Health Watch be at the a hike for March?
We're working towards it. Actually,
Okay.
we'll be delighted to. So it's something that it's work in progress. Really, we've
Progress.
kickstarted the conversations in that regard, and yeah,
Okay.
it will definitely. Hopefully, the next conversation could
Mm.
be about what we did there and keeping insights shared. But thank you
Anyway,
so
but
much,
thank you
really.
so much for having me.
Well, lastly and importantly, is to thank Resolve to Save Lives for being a very instrumental and key partner,
Mhm.
working hand in hand with Nigeria Health Watch for the Future of Health conference, and of course with other partners to make meaningful contributions towards shaping our climate and health agenda in Nigeria, and with very many lessons that can be adapted to similar contexts or the global community as well. Thank you so much, Nanlop.
Yeah. Thank you for having us. And it was also a pleasure to be on that, on the future of health and being on as part of the conversation. And we'll keep it going. We'll have to continue the conversation
Yes,
anyway. It doesn't end here. It doesn't
absolutely.
end there as well.
Yes. Yes.
And because it's on the front burner of, global front burner, basically, at
Yes.
this point. And thanks for having me.
Thank you.
Mhm.